You have the right to know about the hazards of the chemicals in your workplace and how to protect yourself from these hazards. The Hazard Communication Standard, also known as HazCom, developed by the Occupational Safety and Health Administration, gives you that legal right. The purpose of the HazCom standard is to ensure that chemical hazard information is communicated to employees for their safety. The standard provides direction to chemical manufacturers, employers, and employees concerning what they must do to make sure that everyone who works around hazardous chemicals is protected. The standard mandates that employees must understand the chemical hazards and have the information, equipment, and knowledge to safely work with chemicals. The HazCom standard requires chemical manufacturers to determine the hazards of the products they produce and provide the information through labeling and material safety data sheets to users. Employers are required to identify hazardous chemicals in the workplace and provide employees with the information, training, and equipment needed to protect themselves and others. Employees are required to use the training and information about hazardous chemicals to stay safe and healthy on the job. Any substance that can cause bodily injury or death, harm others, and damage or pollute the environment is a hazardous material or chemical. But the fact is, most chemicals are safe if used properly. The chemicals located at your work site include liquid petroleum, insect repellents, degreasers, corrosive substances, carpet cleaning solutions, window washer fluids, window cleaning products, and air fresheners. The more you know about hazardous chemicals, the easier it is to maintain a safe work environment. For example, an employee used hand sanitizer, then lit a cigarette. His hands were immediately engulfed in flames because the alcohol in the hand sanitizer was not allowed to dry. Most workers identify chemicals and their hazards by reading the container labels. The HazCom standard requires all chemical containers to be labeled by the manufacturer or distributor. Bags, barrels, boxes, cans, cylinders, drums, and storage tanks must all have labels. Chemicals that are repackaged or placed in temporary containers must also be labeled. Labels show the name of the chemical and contain information about the chemical hazards. Labels must be written in English and should always tell you the specific hazard warning of a chemical, which includes the identity of the chemical, the name and address of the manufacturer or distributor, any physical hazards, and any health hazards. A chemical label may also tell you proper storage and handling methods, protective clothing, equipment, and procedures necessary to safely use the chemical. If you see a chemical container without a label or with a label in poor condition, notify your supervisor. The most common and widespread chemical labeling systems are the National Fire Protection Association Diamond and the Hazardous Materials Identification Systems. They use a combination of colors, numbers, and symbols to identify chemical hazards. The meanings of these colors are blue to indicate a health hazard, red to indicate a fire hazard, yellow to indicate radioactivity, white indicates a special hazard or need for protective equipment and may also have some type of a symbol or letter. The numbering system is as follows. 0 indicates no hazard, 1 indicates a slight hazard, 2 indicates a moderate hazard, 3 indicates a serious hazard, 4 indicates an extreme hazard. The combinations of numbers, colors, and symbols can provide quick information about the nature of the chemical and its hazards. For your safety, learn how to read the NFPA Diamond and the HMIS labeling systems. The purpose of the MSDS Handbook is to provide an initial point of reference for the identification of hazardous materials and precautions for dangerous chemicals at your work site. Material safety data sheets include all of the important details on a particular chemical. You may not need to know or use all of the information on the MSDS, and you are not expected to memorize the contents. However, you should know where to find them and how to use them. Check the material safety data sheet before using any chemical and follow its safe handling procedures. If you are not sure what the information means, don't take chances. Ask your supervisor. There is no one format for material safety data sheets. The important information printed on the MSDS includes the identity and any hazardous ingredients, physical and chemical characteristics, hazards, safety procedures and equipment that will protect you, the name, address, and phone number of the manufacturer or distributor, first aid measures, firefighting measures, proper handling and storage, transport procedures, stability and reactivity, and other useful information. The material safety data sheets of chemicals used by your work site are located in the back of the management offices at the enterprise work site and the last office in the administration office at National. Wearing the proper clothing and PPE for each job you do can help protect you from serious injury. What you wear on the job and how you care for it is just as important as knowing how to do the job. Most PPE may seem uncomfortable, but it is a small price to pay for your safety and health. All employees are required to wear slip-resistant shoes. Employees reporting for work without the required footwear will receive a formal written warning and be sent home to retrieve shoes or issued a pair of slip-resistant shoe covers. Eye protection should be worn when working with chemicals or hazardous liquids and to minimize hazards from falling or unstable debris. Eye protection can be obtained from your worksite supervisor. Failure to return safety glasses will result in a payroll deduction to cover replacement costs. Locate the eye wash station at your worksite. Chemicals can cause vision problems up to and including blindness. The best first aid for accidental contact is to rinse eyes for 15 to 20 minutes with clean, cool water. Hand protection should be worn when working with chemicals and solvents and extreme hot and cold substances. Disposable gloves are provided for employees. They are located in the pump areas at the enterprise lot and the car wash bay entrances at National. Safety vests should be worn to raise your visibility and minimize risk when exposed to other motorists. Reflective hats should be worn to raise your visibility and minimize your risk when exposed to sunlight. Always wear the appropriate PPE for the job. Use equipment that fits properly. Wear the appropriate clean clothing beneath PPE. Properly maintain PPE, and ask for assistance if you are unsure how to use personal protective equipment. Common injuries related to hazardous materials at your worksite include chemical spills, fire and explosion, and overexposure to heat. Chemical spills are hazardous if they cause an acute problem like a burn to the skin or eyes, or a long-term illness related to repeated exposure. Chemicals can cause a sudden release of pressure, fire, and a chemical reaction. Chemicals can enter the body through breathing. Avoid unnecessary exposure by following the label and MSDS handling and storage precautions, cleaning up spills and leaks immediately, following grounding and bonding procedures when dispensing, using ANSI-approved flammable safety cans for dispensing, using chemicals only in well-ventilated areas, using chemicals away from heat sources, treating empty containers like full containers, and removing saturated clothing immediately. Chemicals can also enter the body through physical contact. Remove saturated clothing immediately and flush exposed body parts for 15 to 20 minutes with clean, cool water. Chemicals can also enter the body through ingestion. After handling chemicals, wash hands thoroughly before eating or smoking. In the event of a fuel spill, notify the enterprise or national management immediately. Notify the parkway supervisor on duty immediately. Eliminate any ignition sources. Clean fuel spills under 25 gallons thoroughly and promptly. Clean up your spills promptly and obtain additional help for cleaning if needed. Shut off fuel pumps and clear the area if fuel pumps continue to discharge. Only employees properly trained in spill containment should clean up large fuel spills. Always use dry methods for cleanup. Use a dike or berm to prevent fluids from entering storm drains. Spread absorbents including socks, absorbent pads, and sausage booms. Sweep or pick up absorbent materials. Wear the proper gloves when picking up absorbents and properly dispose of waste. Please note the location of the emergency fuel shutoff valve and fuel spill kits at your worksite. If there is a fire at or near the fueling area, shut off the fuel and clear the area immediately. Call 911, notify management, and evacuate non-essential personnel to the designated emergency meeting location. Never extinguish a fire yourself unless the fire is small enough to handle, there is an escape route, you have been properly trained in the use of fire extinguishers, and the proper fire extinguisher is handy. Portable fire extinguishers are classified to indicate their ability to handle specific classes and sizes of fires. Labels on the extinguishers indicate the class and relative size of the fire that they can be expected to handle. To extinguish a fire, break the seal and pull the pin, aim at the base of the fire, squeeze the trigger, and sweep the extinguisher from side to side. Remember, pass, pull, aim, squeeze, sweep. Know the location of fire alarms throughout your worksite. Know your worksite's evacuation procedures, escape routes, and evacuation assembly areas. Know your responsibility under the emergency plan. Know the location of fire extinguishers and how to use them, and act quickly when you hear an alarm. Close any windows and doors not needed for escape. Assist disabled employees. Leave by your assigned exit or the closest safe exit. Go to the assigned safe place. Stay in your assigned safe place until authorized to leave and follow any additional instructions. Environmental factors contributing to heat-related illness include air temperature, relative humidity, direct exposure to sunlight, airflow, the type of work performed, the duration of exposure, and the amount and type of PPE worn. Personal risk factors include age, the body's ability to adapt to heat, any pre-existing medical conditions, water consumption, alcohol, caffeine, and tobacco use, and medications that may affect the body's response to heat. Heat edema is caused by water trapped in body tissue, which results in swelling or puffiness of the extremities. Heat cramps is characterized by painful spasms in muscles of the arms, legs, or abdomen. Heat syncope is characterized by dizziness with prolonged standing or upon sudden rising from a seated or lying position. Employees that exhibit heat edema should be moved to a cooler place. Heavy clothing and PPE should be removed. Cool, wet cloths should be applied to the body. The feet should be elevated, and edema should be treated by a physician. Employees that demonstrate symptoms of heat cramps or heat syncope should be moved to a cooler place. Heavy clothing and PPE should be removed. Water mixed with salt or a sport beverage with electrolytes should be administered. If symptoms persist or worsen, seek medical attention. Heat exhaustion is characterized by heavy sweating, red or pale cool moist skin, lightheadedness, and nausea. Employees exhibiting heat exhaustion should be moved to a cooler place, rehydrated, and allowed to rest. Untreated heat exhaustion can progress into a heat stroke. See a physician that day if symptoms get worse or last for more than 1 hour, or if the person is nauseated or vomiting. Symptoms of heat stroke include a body temperature of at least 104.9 degrees and noticeable mental and physical changes. These changes are characterized by confusion, difficulty breathing, excessive sweating, no sweating, red, hot, dry skin, and vomiting and diarrhea. This is a medical emergency. Move the person out of direct sunlight. Remove unnecessary clothing. Place the person on their side to expose more skin to air. Cool the entire body with cool water. Apply ice packs to groin, neck, and armpits, and watch for signs of rapidly progressing heat stroke. Do not use cold water to cool the body. Do not immerse the person in an ice bath, and do not use aspirin or acetaminophen to lower body temperature. Heat-related illnesses can be prevented by drinking water every 15 minutes, even if you're not thirsty. Rest in the shade to cool down and remove PPE. Learn the signs of heat illness and what to do in an emergency. Keep an eye on fellow workers and respond quickly. Your safety and health and the protection of property, the general public, and the environment are of the utmost importance. Each person must carry out his or her individual responsibilities with the proper attitude. Each employee is expected to accept the personal responsibility to work in the safest manner possible, abide by all safety rules, and actively participate in safety programs. Parkway staffing is committed to providing the leadership and support necessary to develop and maintain a successful safety program.